Have you ever experienced joint discomfort? That nagging pain that can affect your hands, feet, hips, knees, or spine. It's a common issue, and it can range from constant discomfort to intermittent pain. But what's causing it? That's what we're here to explore in this video. Join us as we dive into the world of joint pain and discover the various factors that might be behind those aches and soreness. From conditions like osteoarthritis to injuries like tendon and ligament issues, we'll break down the top reasons you might be experiencing joint discomfort. So, if you've ever wondered what's behind that stiffness, itchiness, or swelling in your joints, stay tuned. Number 1. Osteoarthritis. Sometimes called wear and tear arthritis, osteoarthritis is the most common culprit in joint pain. It occurs when the lining of the joints, called cartilage, is worn down. Although osteoarthritis can damage any joint, it most commonly affects the knees, hands, and hips. The primary risk factors for osteoarthritis are obesity, a traumatic injury, or a lack of physical activity. To feel better, it helps to lose weight and to exercise, and physical therapy can make a big difference. Over-the-counter pain medication and anti-inflammatory topical gels and creams can help, as can injections of either the steroid cortisone or platelet-rich plasma, PRP. In the knee, hyaluronic acid injections are also an option. Using PRP, doctors can extract platelets from the patient's blood and then inject the platelets into the damaged joint or tendons to bring relief. Number 2. Tendon injuries. The second most common cause of joint pain is injury to the tendons, which can range from inflammation and swelling to a partial or full tear. Tendons are the extension of muscles that attach on a bone, and these often attach around joints. This means you may feel like the pain is in your joint, but it's really a muscle. For college and professional athletes, a torn tendon may be treated with surgery. For most people, treatment may involve some combination of over-the-counter pain medication, rest, cortisone injections, PRP, or physical therapy. Physical therapy can help strengthen the other muscles around the injured muscle, so it doesn't have to work as hard. Number 3. Rheumatoid arthritis. Rheumatoid arthritis, RA, is usually symmetrical, affecting the joints on both sides of the body at once. It is caused by your immune system mistakenly attacking the tissues in your joints. RA causes pain, swelling, and stiffness in the joints. The joints may also become deformed. The early morning stiffness from RA usually lasts longer than an hour, in contrast to that in osteoarthritis, which goes fairly quickly. Joints that are commonly affected by rheumatoid arthritis are the hands, wrists, and feet. The symptoms may not be constant. They can come, flares, and go, periods of remission. Number 4. Ligament injuries. Injured ligaments can cause joint pain, particularly around the knees and ankles. Ligaments are pieces of tissue that attach bones to each other. Trauma, such as a forceful hit, is the primary cause of an injured ligament. Just like the tendon, you can partially or fully tear your ligaments. Some ligaments can heal on their own, while others require you to wear a brace. Surgery is necessary to repair large tears. Number 5. Gout. A common, painful form of arthritis, gout causes a chemical called uric acid to build up in the blood. This acid then leaks into the joints and makes crystals in the body's joints, fluids, and tissues. The crystals can be very painful and cause lots of swelling, pain, and redness in the joints, such as your big toe, hand, wrist, or knee. People with gout should avoid alcohol, red meat, and shellfish in their diets, because these can make gout worse. If diet modification does not ease your pain, your healthcare provider may prescribe medication to lower the amount of uric acid in your blood. Number 6. Bursitis. Bursitis is inflammation of the small fluid-filled sacs that cushion your joints. One of the most common areas for bursitis is the shoulder joint. Other joints that are commonly affected are the hip joint, knee joint, and the elbow joint. Overuse injuries or repeated pressure, for example from kneeling, can cause bursitis. Infection or sudden injury are other potential causes. The pain may occur suddenly or may build up gradually. The joint may be swollen. Number 7. Injured meniscus. An injury to the meniscus, which is the cartilage in your knee that cushions and stabilizes the knee joint, is a common cause of knee pain. Although the meniscus is usually injured while playing sports, arthritis in the knee can also cause painful tears in the meniscus. During some activities, especially contact sports, your knee can twist and tear the cartilage that provides cushioning between your thigh bone and shin bone. Surgery is sometimes needed, but meniscus injuries also can be treated with physical therapy or cortisone or hyaluronic acid injections. Number 8. Infectious diseases. Some infectious diseases can have joint pain as a symptom, e.g. Lyme disease, typhus, influenza, hepatitis, rubella, and rarely chickenpox. Reactive arthritis is arthritis that develops in response to an infection in your body. Some bacterial infections can cause reactive arthritis, for example, Salmonella, Chlamydia, and Clostridium difficile. However, not everyone who gets these infections will develop reactive arthritis, only a small number of people will. If you found this information helpful, don't forget to give us a thumbs up and subscribe for more insightful content on health and well-being. Feel free to share your experiences or any questions you might have in the comments below. Here's to healthier, pain-free joints and a more active life ahead. Stay tuned for more informative videos and take care of those joints.